I just wanted to take a few minutes and walk through the patient bonding video. First, you're going to see our setup, which is the pumice, measuring gauge, curing light, cotton rolls, the dry guard sticks, NOLAs, green etch, primers, and of course, adhesives. We place a cotton roll underneath the tongue, and we use the dry tip stick, which is all it is a dry tip stapled to a tongue depressor. This technique is good because the cotton roll stays underneath the tongue and helps protect that saliva gland, while the stick pulls the cheek out and you have a better visual. Also, the dry tip is covering the parotid gland that's found in the cheek. So now we're just going to dry the molars and we apply L-Pop. So L-Pop is a etch and primer all in one. You're able to get in, get out, and not have to rinse and dry or spend so much time in there. It makes it go a lot faster. After the L-Pop, we add a little bit of Assure Plus, light it, and I will place the brackets on the teeth while Dr. Pitts makes sure they're perfect, and we light it. We always do 7 and then 6, and then we go to the top and we do 7 and 6. We always prep all 4 molars at the same time, and we light 2 at a time. We always start on the right side and then we jump to the left and do the exact same thing. And we always get a new stick and a new cotton roll underneath the tongue. After all molars are done, Dr. Pitts will go in and recontour the teeth. Once he's finished with that, he can get up and go see an exam or another patient while I prep 5 to 5. While I'm prepping 5 to 5, I always take a dry angle and stick it on the right and left side of the cheek, once again to cover that parotid gland. Then we add the NOLA. We'll have the patient bite down and just remind them to keep their tongue in the back of their throat while we dry the teeth. When we apply etch, we always etch the entire tooth, and the etch stays on there for 30 seconds. I always go in with a high volume suction and suck up all of the green etch first before you rinse and dry, just that way we can eliminate how much touches their tongue. You can have them rock their head side to side while you rinse and dry one side, and then you can do the other side to eliminate them having to taste it as much as possible. At this point, we want to dry a little bit until we start to see a little chalky white. And then I'm going to add a cotton roll on the lower lip in front of the teeth. And this is an important step because now we're going to add 2 cotton rolls inside their mouth, one under their tongue and one at the roof of their mouth. But the small cotton that you put in the lower lip is really important because when they open their mouth, you don't want their lip to rub against their teeth because this can compromise your prep. It's always best to use cotton pliers or hemostat to help put the cotton roll underneath the tongue and at the roof of their mouth. Then just have them bite down while it's inside. Once they're biting comfortably, you can take that lower cotton roll out of their lip. Unless the patient's lip is really close to the teeth, you could leave it in there to be safe, but most of the time you can take it out. At this point, you want to go back in and just completely dry everything, make sure it's bone dry. Now it's time for the Assure Plus. We add a little bit of Assure Plus on the teeth and we light it. So the reason why we etch the entire tooth is because after Assure Plus, you will use Pro Seal. And Pro Seal you have to be really careful with because if you use too much on the tooth, you can turn the tooth yellow. So you want to use a little brush, and you just want enough on your brush to do at least 3 or 4 teeth, and you just want to go from the gingiva down to the incisal edge. Just paint down a few times, and you want to do that for every tooth, and this helps against demineralization. Then after this step, we want to light it. Now we're ready for the braces. At this point, I will call doctor over. Placing the brackets 5 to 5 is just like placing the 6s and 7s. I will place the bracket on the tooth, Dr. Pitts will make it perfect, and we will light it. We usually do 2 to 3 brackets at a time, and then we light it. So our sequence of placing brackets, because the back teeth are most vulnerable to getting wet, we always do lower 5-4-3 on the right, then we do lower 5-4-3 on the left, and then lower 2-2. Then we go to the upper, do the same thing. Upper right, 5-4-3, upper left, 5-4-3, and Dr. Pitts will do the upper 1s first, and then the 2s. Also, while we're placing brackets, Dr. Pitts will hold the bracket with his director, and I will come in with a mini micro brush, and on the mini micro brush I just have a little bit of a surplus, and I go around the bracket and I just clean off the flash while he holds the bracket. While we place brackets, the doors are always open, and most of the time Dr. Pitts will use the measuring gauge for upper 3-3. During the bonding procedure, we usually do about a 3 to 5 second cure while we're placing brackets. Once doctor's finished, I go back with the curing light and I cure 15 seconds in between every tooth. This way, you're curing 2 teeth at a time. Inserting the wires are extremely easy. I love using the director tool to help push the wire into the slot as I close the door with my finger. Especially if you have a tooth that's really rotated, the director tool is super easy. It helps put the wire into the slot and you can close the door really easily. Dr. Pitts and I really care about speed and efficiency. When Dr. Pitts and I are doing a new patient bond, we can do brackets and I can do the wires and we can get done in as little as 35 to 40 minutes. We take photos at every visit and we go over instructions, rubber bands, and we also schedule chairside. So with all of that, the patient's usually walking out of the door in about an hour.
I have no doubt you will see the OC difference and be wowed by the beautiful finishes you will deliver to your patients. Do not hesitate to call your